Hey, I am Mr. Shrum, and I'm back again with another one of these lesson walkthroughs. And we're going to finish up the second part of this section. And today we're going to look at skull anatomy. So this will be fun. We're looking at the human skull. And here we have a nice side view. Let's zoom in even more, get a better look. There we go. So we're going to learn about bones, fontanelles, sutures, cavities, and sinuses all within your head. Good stuff. The skull consists of 8 cranial bones and 14 facial bones. These bones protect the brain and other sensory organs and give shape to the face. So here you see the different bones and where they are all located. We're going to take a look at them later. So one by one, we'll start with the cranial bones. The cranial bones, another name for the bones of the skull, we have the frontal bone, the 2 parietal bones, occipital bone, 2 temporal bones, bam. Sphenoid bone, ethmoid bone, okay. So that frontal bone is located at the upper front portion of the skull. And it's also what we would consider the forehead. So that right there, every time you face palm or touch your forehead, you're touching your frontal bone, your frontal cranial bone. Next, we have these 2 bones on the right and left side of the skull, the parietal bones. They are the largest and most superior bones of the skull. So right here you see this big section of the head is covered with this bone. They cover most of that top section of your head, and they extend slightly down the right and left side. They join together on the top of the head. So up here, they're joined together. The occipital bone is located at the very back of the skull, and that's the base of the cranium. It's below the parietal bones. The 2 temporal bones on the right and left side, these form part of the sides of the skull and join with the occipital bone at the base of the cranium. They are both located on the lateral portion of the skull. So down here on the sides, but lower down on the sides than the bones we talked about before. Then we have this sphenoid bone right here. See this tiny little lilac purplish section? There are 2 sphenoid bones on the right and left sides of the skull. They are wedge-shaped bones with a central part with 2 wing-like structures. They help form the sides of the skull, the eye sockets, and the base of the cranium. They are located on the lateral portion, lateral meaning side portion of the skull, and they're below the frontal bone. So see where it is in relation to everything else we're talking about, right there. Ethmoid bone. They describe this as a moth-shaped bone. I suppose it looks kind of like a moth. Sure. But that's located within the skull. That makes up part of the orbit or eye sockets. So right here, see where your eyes usually go? That is where the ethmoid bone lies. Now, we talked about cranial. It's more this section, your top of the head. But then we have that face region, and this is composed of facial bones. So we're talking about the mandible to zygomatic bones to maxillary bones to palatine bones to lacrimal bones to nasal bones to nasal conchae. I think that's how you say that, conchae, and vomer. So let's take a look at each of those. The mandible, just kidding. The mandible is the most frontal bone of the skull. It's the largest and strongest facial bone. The mandible makes up the chin and lower jaw. The upper portion of the mandible supports the lower teeth. The mandible is the only movable bone of the skull. So that's pretty cool. You can move your mandible. You move it all the time. Facial bones, zygomatic bone. So these are your cheekbones, that little section that pop out to the side. They are right below the eye sockets, and they help form your face or shape your face to some degree. Then we have the maxillary bones, and they form that upper jaw region. They join together all of the immovable facial bones. The lower portion of the maxillary bone supports the upper teeth. Maxilla is the singular term when referring to just one bone, but when you refer to all of them, you can use this term. And then we have the palatine bone. The maxillary bones form most of the roof of the mouth, or hard palate. However, the palatine bone is an L-shaped bone that forms the posterior third or back portion of the hard palate. Lacrimal bone. These bones are the smallest of the facial bones. They make up part of the inner wall of each eye socket, closest to the nose. The lacrimal bones house the tear ducts as well. Lacrima is related to tear. The word is related to tear. Then we have the nasal bones. These are rectangular bones that join to form the bridge of the nose. The most visible part of your nose is formed by the nasal bone. Nasal conchae, that's the plural way to say that. They are scroll-like bones that are located inside the nasal cavity. Concha is the singular term when referring to one bone. Conchae, you just add an E to it and then say it like conchae to pluralize it. But you see concha here, concha. All of these are within your nose, your nasal cavity. The vomer is a short, thin bone that creates the lower portion of the nasal septum. Vomer. It's an interesting name for a bone. You can kind of see the shape of the nose here. Fontanelles. A mature human skull is very hard, but at birth, infants, babies, an infant has fontanelles, or soft spots between the bones of the skull. So you can kind of see here the structure of the bones and where there are soft spots in between, the fontanelle. These allow the skull to pass more easily through the birth canal and close between the ages of 3 months and 2 years. So if a baby were to have the hard skull that they grow into, that would make childbirth very problematic, as it's already pretty problematic. So that's going on there. And then you have several types of fontanelles depending on where they're showing up. Sphenoidal, mastoid, posterior, anterior fontanelles. And this diagram shows you where they are. Now, sutures are fixed joints on the skull. These joints connect the bones of the skull, but do not move or articulate motion. The sutures are loosely attached in infancy when you're very young, so the brain has room to grow and expand. As the skull matures, the bones of the head are securely connected, forming suture joints. And this diagram shows you more of that. There we go. So we have sagittal suture, coronal suture, lambdoid suture, and squamous sutures. There are also cavities in the skull, and a cavity is just a hole or opening within a mass. So consider the head, the skull, a mass. Any holes within it is considered a cavity. These cavities contain the brain and sensory organs, such as the eye. So let's see. The cranial cavity houses the brain, the orbits or eye sockets, house the eyes, the nasal cavity, the oral cavity, mouth, and the ear cavities. There's the cranial cavity up top, contains the brain. The orbits contain the eyes, their muscles, nerves, blood vessels, and fat. They're frontal on the human skull next to the nasal cavity. So everything's kind of close together on our faces. The nasal cavity is on the front of the skull, front of the nose, no, the front of the skull, and in the middle of your face. The sinuses branch off from the nasal cavity. Air enters the body through the nasal cavity when we breathe. And then we have that oral cavity too, that mouth. That's right below our nasal cavity and in the middle of the face as well. It's the cavity through which food enters the body. If you love to eat, you use the oral cavity all the time. I mean, we all eat, so we're all familiar with that cavity. The ear cavities are located laterally on either side of the head. If you're a good listener, you use the ear cavities a lot. We all do. But here, you see it a lot smaller than the nasal or mouth cavity for sure. The external ear cavity is known as the external auditory meatus. The middle ear cavity is the eardrum and houses the 3 smallest bones in the body. If you remember the anvil or incus, the stirrup or stapes, and the hammer or malleus. Together, these bones are known as the auditory ossicles. The inner ear cavity is shaped like a snail and houses the cochlea. I like cochlea. Where sound waves are converted to nerve signals and sent to the brain. Sinuses. The skull also contains 4 main sinuses. A sinus is a hole similar to a cavity that is connected to the nasal cavity. Sinuses are lined with tiny hairs called cilia and membranes that secrete mucus that lubricates the nasal cavity and drains out through your nose. The sinuses of the skull include the frontal sinus cavity, the maxillary sinus cavity, sphenoidal sinus cavities, and the ethmoid sinus cavities. So if you ever hear people talk about their sinuses, picture this next time. It's holes near your other cavities, like your eyes, nose. And that's what people mean by sinus headache. Usually has to do with this area. The frontal sinus cavity is found in the frontal bone above your eye sockets. So up here. The maxillary sinus cavity is the largest sinus and is located between the eye sockets and your upper teeth. So between your eyes and your mouth, right there. Sphenoidal sinus cavity. There are 2, which are located on either side of the sphenoid bone. It's right here, on either side. Ethmoid sinus cavity. The ethmoid sinus cavity sits between the nose and the eyes and can vary in number between 6 and 12. All up here. Okay, so that's the end of the skull anatomy section. Let's head back and then talk about the vertebral column. So the vertebral column is your spine, and that's a lovely picture of your spine. It's a part of the axial skeleton, and it holds the head and torso upright. It consists of 33 vertebrae, which are ring-like irregular bones that form the backbone. The lower 9 vertebrae are infused into larger bones, the sacrum and the coccyx, leaving 26 of the vertebrae as movable components. So here's a diagram. You can see here, coccyx, the sacral vertebra, lumbar vertebra, thoracic vertebra, cervical vertebra, neck, middle region, lumbar lower region. Those are the 5 regions. So the naming convention. So how do we name things? Why are they named in such a way? Well, for example, the first cervical vertebra is called C1 and the second is called C2. And that goes all through C7. So up here, the first 7 are the cervical vertebra. And you go C1, C2, C3, C4, C5, C6, C7. Other vertebral sections have the same naming convention. So the thoracic vertebra would have, for example, T1. The first lumbar vertebra is L1. And that's how we refer to which section and vertebra we're talking about. The cervical region is the most superior, the most upper on the vertebral column, and it's known as the neck. We talk about the neck. It begins at the base of the cranium, extending downward to the thoracic vertebrae. And there are 7 cervical vertebrae. The first cervical vertebra, C1, is also known as the atlas because it holds up the cranium. That is from mythology, where Atlas is holding up the world, and that is why it's nicknamed Atlas. C2 is called the axis because it is the main pivot point in the neck. While C1 holds it up, C2 allows it to pivot. The thoracic region is the spinal region in the upper and mid back that consists of 12 vertebrae. This is the largest section of the spine. And we have T1 through T10 has ribs that attach to them through articular facets on the transverse processes. And all that means is the first 10, they have ribs attached to them. These ribs curve along the body or around the body and form your rib cage, attaching at the sternum on the other end. So the spine is attached to ribs, they curve around, and then they meet near your chest, the sternum. The rib cage protects the organs in your chest. So that's like your protection. T11 and T12 are also attached to ribs, but those ribs don't connect to the chest wall. I think they're a little too low for that. They're called false or floating ribs. The lumbar region is the spinal region that makes up the low back. It contains 5 vertebrae, which are the largest and most weight-bearing bones of the vertebral column. The sacrum is composed of 5 vertebrae fused at faint grooves known as transverse lines. These vertebrae are initially separate, but fused together in early adulthood. The sacrum sits inferior to the lumbar vertebrae, superior to the coccyx, and between the coxal bones of the pelvis, which are fused at the sacroiliac joints. So what you really need to take away from all of this is that it sits very low, and it's composed of 5 vertebrae. And the lower region is important. That's what I want you to take away from that. And then lastly, you have the coccyx, also known as the tailbone. It contains 4 fused vertebrae, and it's the most inferior or the most lower position of the vertebral column. The main portion of the vertebrae is known as the vertebral body. The arching bone between the vertebral body and the spinous process is known as the vertebral arch. And if you look at this diagram, it will show you the various components of vertebra. Okay. So a lot of processes are held here. For instance, the spinous process projects posteriorly from the vertebral arch. That means behind. So this is the bony projection you can feel on each vertebrae as you run your hand down your spine. That little portion right there. Additional processes of the vertebrae include 2 transverse processes, 2 superior articular processes, 2 inferior articular processes. And those are listed here. The anterior here, front, and then posterior, superior, inferior. The vertebral foramen is a hole or tunnel through which the spinal cord and connective tissue around the spinal cord are enclosed and protected. So here we go, that yellow portion. And then to get another look at that, nerve roots exit the spine through spaces in the vertebrae called intervertebral foramen. Facet joints are between each movable vertebra and determine the range of flexibility. The vertebrae are connected by a series of mobile joints that contain intervertebral discs. And these discs are made up of fibrous cartilage that cushions the bones and absorbs shock. So those discs are just cartilage that are placed between the bones, and they take the heat off of any of your bones so they don't get damaged, hopefully. The vertebral column is surrounded by ligaments and muscles that help stabilize it and control movement. Together, all of the vertebrae in the vertebral column give it a type of S shape when viewed from the side. The shape allows for flexibility and movement in all planes, as well as absorption of weight and pressure. So that is the end of the vertebral column section. So we learned about the skull, the skull anatomy, and your spine, all very key parts of our body. So I hope you enjoyed that and that was helpful. And I will talk to you guys next time. See ya.